Good afternoon. Thank you for joining us today. My name is Sarah McGinley. I'm an occupational therapist at the University of Southampton. I'm one of the occupational therapy lecturers on the BSc and the MSc programs here, and I'm also an admissions tutor. I'm joined today by Belinda Williams, who will also be taking part in the session later on. So very nice to see you. What we'd like to do today is give you a brief overview of our programs and also talk you through how to strengthen your application, and this is really where our students will come into their own and talk to you guys as well. So the picture you can see on your screen here is actually in our Activities of Daily Living suite, which is here based on Highfield campus at Southampton. And just to give you a session outline of today, so already told you my name is Sarah McGinley. And we're going to talk about the programme, give you a brief overview of what you would expect if you were to come and study here at Southampton. We also, in the chat, you will see some links to some videos. So there's several videos that we'd really encourage you to go and have a look at in your own time. There's a subject to talk one, there's a student experience, and there's one around placement replacement module, which was when the pandemic first hit and students were unable to go out on placement, and what we did in that event. As I said, we've got two students here today who will come on screen and share with you their reflections on their own application process, and we'll talk to you about how to prepare to apply for the programme. We'll spend some time talking about work experience and why it's important that you demonstrate you've had work experience, preferably in occupational therapy, but if not, in health and social care in general, and how you can apply that to the role of an occupational therapist. We'll talk about the application process, so we'll talk about UCAS, we'll talk about applying to Southampton. So we are part of the Faculty of Health Sciences. We're one of the UK's leading schools in health professions for education and research, which we're really, really proud of. We have a growing national and international reputation in the health sector, and that really is thanks to the staff that we have on programme. We have occupational therapists working with us who still work clinically. Some of us are working in research, and some of us work full-time in education, or a combination of all three of those things. So within the Faculty of Health Sciences, we have obviously occupational therapy, physiotherapy, podiatry, healthcare science, nursing and midwifery. And if you do decide to come and study here, you will have the pleasure of studying with all of those professions, really in preparation for getting you ready for practice out in the real world. So both our OT programmes, our BSc and our MSc programmes, offer you the opportunity to join our professional body, which is the British Association of Occupational Therapists, also known as the Royal College of Occupational Therapists, and it gives you that eligibility to apply to register with the Health and Care Professions Council in the UK. So once you've met all the requirements of the programme, you can then apply to a professional register which will allow you to hold the title of occupational therapist and to work under the register of the HCPC. Our programmes are accredited by the World Federation of Occupational Therapy, which means they're recognised worldwide, and if it is your desire to go and work in a different part of the world, then training to be an occupational therapist is a really, really good option, because you can travel to all kinds of places and work as an OT once you've got your basic qualification here in the UK. So as I said before, we are a teaching team. All of us are therapists, with the exception of, you can see on the screen there, we have Maggie Donovan Hall, who is a doctor in psychology, and we have James Gavin, who is a doctor in physiology. Everybody else on the screen there is an occupational therapist, so is registered with the HCPC, as I just mentioned. We have Rachel Dadswell in the corner, who is our programme lead. And I won't talk through everybody, but as you can see, we're a mixed bunch of therapists there, and all of us, like I say, are either still working in practice, or we're doing our own research, or we're working full-time in education. We all have our special interests, and that really influences the direction of our teaching and then the education projects that we work on with our students, which is really exciting. In terms of research, you're probably very aware that the University of Southampton is a Russell Group university, so it's a very prestigious university, known for its research and known for its research quality, and the occupational therapy team is very proud of that. And here on the screen you can see just a few examples of the things that our OT team have been working on in the last couple of years. So some real diverse projects, from looking at communication for people living with cancer to looking at orthotics for people with rheumatoid arthritis in their fingers. And you can see there on the screen some jewellery that often is not very aesthetically pleasing, but research has developed some pieces of orthotics that are nicer to look at and more comfortable for clients to wear. We also are really proud of the work that we do globally. So we have projects in Cambodia and Uganda, looking at how to improve services for people who use prosthetic limbs. And also we have work going on in Brazil around frailty. If you decide to come and be a student here at the University of Southampton, we have some great virtual collaborations with universities around the world. So we have collaborations currently with Sweden, Ireland, Australia, Hong Kong, South Africa, Canada, France and Croatia. So it's a really exciting time to come and train to be an OT. In terms of what makes us unique at Southampton, this is a poster that we developed for something called Occupational Therapy Week, which runs every year in November. And there's 3 points that we like to focus on here at Southampton. So, like I just mentioned, the international collaborations that we offer our students. So pre-COVID, we were able to offer physical exchanges. Sadly, at the moment, that's all on hold, but we still really have this important, strong thread running through the programme that exposes our students to OT students in other countries. So we call that internationalisation of the classroom. We also focus very much on role emerging and non-traditional or diverse practice for our students. So in your final year of practice, you will have the opportunity to undertake a diverse placement. So generally that means an area where occupational therapists have traditionally not worked, or maybe they're just starting to emerge into that area. Examples of that have included working with charities for young carers, for the Criminal Justice Service, for the Job Centre in GP practices, with the Fire Brigade and Ambulance Service, and with perinatal services. So lots and lots of rich experience for you to be able to explore there in terms of developing OT. And then we're actually the only UK university to be able to offer some OT specific training for our undergraduates, which really uses an occupational lens. So there's 2 bits of training that we offer. So we have the assessment of motor processing skills and the ESI training, and both of those are unique to this university. So if you come here, you have the opportunity to do that training at an extra cost, but to go out as a graduate and to have those qualifications is unique. You won't find that anywhere else in the UK. So the way our programme runs, our educational focus, I'll look at the BSc programme first and then lead into the MSc programme. So the BSc programme is a 3-year programme, and it's split down into what we call level 4, level 5 and level 6. So year 1 being level 4, it's very student focused, so it's where students learn about themselves. It's very reflective, they start to experience new things, maybe try new occupations, start to think about how they themselves might respond to new situations. And that's really important when we start to think about how we might work with the clients that we might see in daily practice. Level 5 is year 2, and we move that learning. It's a spiral approach to learning. So level 4 is that foundational knowledge where students look at themselves. We then step it up a gear into level 5, year 2, where we start looking at specific client groups or clients that you might work with as an occupational therapist. And then in level 6, in year 3, again, it's another foundational level. We're looking much bigger, a bigger picture. We're looking at the services in which OTs will work in. So that could be the NHS, it could be local authority, it could could be charities, it could be private organisations. So we're thinking bigger, and we're thinking the populations and the services that we might work within and that we might influence in terms of healthcare provision. The MSc programme is still a pre-registration programme, so it's designed for people who have a first degree, a relevant degree, which might be in a social science or a pure science, who want to come and then train as to be an occupational therapist. So as you would expect, it's a condensed programme. It's over 2 calendar years, but it straddles those 3 years of the BSc. So there are times when, as an MSc student, you would also be working with BSc students on shared modules. You'd also have individual modules that were unique to the MSc programme. If you've got any questions about the differences in the programmes, please do pop them in the chat and we can help you navigate that. So this up on the screen now is just an overview, an example of actually the BSc programme. So we talked about that educational approach, and this is just an example of what those 3 years look like when they're split out. So you can see from the screen there, in year 1 you have 1 placement, which is 6 weeks long. In year 2 you have 2 placements together, they're both 6 weeks. And then in year 3 you have a longer placement, which is 10 weeks. And that amounts to 1,000 clinical practice hours out in practice, and that's required for you to register with the HCPC. You'll see dotted around on the timetable there various modules. Again, you'll see a thread, so we have therapeutic engagement and partnerships that runs all the way through the programme. We have a module in year 1, year 2 and year 3. We also have a design module that runs in year 1 and 2, and then you have some shared modules, so the interprofessional practice in year 1 and your influencing innovation and change are both modules that you would do with your allied health profession and nursing colleagues. In terms of the assessments that we offer for our students, it's a real eclectic mix. So you'll never just do exams, you'll never just do essays. We do try and make sure that our assessments are varied and diverse. So in terms of written assessments, you will prepare a research proposal in your 2nd year, which will then go on to be your final project in your 3rd year. You might write some reflective case studies. You may have pen and paper exam. You might prepare posters or some kind of recording, that could be a video or maybe a blog. In terms of practical assessments, you're very much looking at simulated practice. So you might be simulating what might be going on in the community or in the hospital setting, for example, as an examination. You might also be involved in group presentations and individual presentations. And then, of course, there's the opportunity to do your 1,000 hours out in practice, and that is assessed by a qualified occupational therapist who's working in practice. While we're talking about placements, it's important for you to be aware that although the university is based in Southampton, not all placements are based within the local area. So when you're thinking about where to study, it's really important that you appreciate you could be sent further afield to a place that maybe requires you to commute, or maybe even somewhere that requires you to go and live somewhere else, so to have second accommodation for a 6 or a 10-week period. So placements tend to be obviously in and around Southampton, but down as far as the Isle of Wight, across into Dorset, up towards Salisbury, Winchester, across to Chichester. So if you think about the square at the bottom of the country, that's really where our placements might be. So over the 4 placements that you have in the undergraduate and the BSc programme, they will be a mix, and that's our responsibility as a programme to ensure that you have a diverse experience within practice. So that will be across physical and mental health settings, and it will be across an inpatient setting versus a community setting. So you won't come out having only ever worked in a hospital or having only ever worked in the community. There'll be a mix of those, and within that there'll be a range of different types of conditions and service users that you will work with. In terms of the academic requirements for entry to the programme, these are published on our website. So we're looking for 5 GCSEs, which must include maths, English and a science, and all grade C or grade 4 and above. And then in addition to those GCSEs, we're looking for 3 A-levels equivalent to BBB. One must be in a science subject. So it could be in sociology or psychology, so social science is absolutely acceptable. And then we do have options when you're looking at if you've taken a BTEC or if you've taken an Access to Higher Education course. So again, if you've got any questions specifically around qualifications, please do pop them in the chat and we can endeavour to answer them for you. Otherwise, we can refer you to our admissions team and let you have their email address. Now, as this is a professional course, equal to the academic requirements, we really need to know about your professional ability as well. So as much as our academic requirements are important, our professional requirements are also really important. So in terms of work experience, I can't labour this point enough. We really want you to get out there and to see occupational therapists in practice. So if you're able to get work experience, be that face-to-face or virtual, that's really important. The more that you can get, the better, because that will strengthen your application, which we'll talk a little bit more about later. So we really ideally want you to go out and speak to occupational therapists. So if you think about the diverse range of settings that OTs work in, be creative. Don't just approach your local hospital. Think about local government, think about schools, think about charities. Do a Google search, see where your local OT teams are hiding out and see if you can get your foot in the door. So preparation really is key. Make sure you use the opportunity. So if you get that opportunity to go and shadow an OT, even if it's for half a day or a couple of hours, go prepared with questions, take some notes, reflect on your experience, think about what you learned from that experience. How did it impact you? How will it impact you moving into the profession of OT? So really reflect on what you learned. Don't just tell us what you saw, tell us what it meant to you and how you'll use that moving forwards. So in terms of the application process, UCAS, as you probably know, is now open and it closes on the 26th of January next year. So once we get all those applications in, we start working through them. It's not a first come, first serve. So if you get your application in before the 26th of January, you have an equal opportunity to be screened and to be invited to interview. So first of all, a team will screen your academic qualifications, and if you pass that part, your application will come through to myself and Belinda as admissions tutors, and we'll be really interested in your personal statement, which is what our second part of our session is going to be about. So if your personal statement meets our requirements, you'll be shortlisted to an interview, and interviews for this academic cycle for entry in 2022 will continue to be virtual. So they'll be on the Teams platform. You'll be invited to an interview where you will meet two members of staff. Could be a member of staff of the OT team here at the university, could also be a clinician working in practice. We then go away and make our decisions and let you know as soon as we can. And really what we're looking for is really that work experience in your personal statement. So I can't tell you that enough. If you pass the initial part with your academic qualifications, you don't then need to tell us about those qualifications in your personal statement. We're much more interested in understanding why you want to be an OT, how you found out about it, and what you've done to get you to this point in time.
Hello there, my name is Belinda Williams. Like Sarah, I'm one of the admissions tutors and also one of the occupational therapy lecturers here on our OT programmes at the University of Southampton. So really lovely to have you with us this afternoon, and hope you're already feeling really inspired about our profession as occupational therapists and starting to twitch and think about how you can find out a little bit more about what it is that we do and start preparing your application to potentially come and join us in 2022. So this next part of the session, we're going to be hopefully helping you think about everything that you have to offer already on your journey to become an occupational therapist, and then thinking about what other things you can do to help prepare and help develop your personal statement, so that when, as admissions tutors, your personal statement lands with us, it really jumps out and speaks to us, and we really get a sense of who you are as a person and what you're going to bring to our profession as occupational therapists. So hopefully this next part of our session will really help you to do that. And we've got some of our lovely students who are going to share some of their experiences about and what they did to start their journey to becoming occupational therapists. So hopefully that will give you a really good platform to build on. And as we're thinking about some of these things, hopefully you will see that real importance of getting that work experience that Sarah was just talking about, to really make sure that you can use that to support and strengthen your personal statement. Okay, so we've got a little series of questions here, and I'm going to invite some of our students to answer some of these questions. But as we're sort of thinking these things through and our students are reflecting on their experiences, if you've got some of your own experiences that you've done so far as part of preparing to become an occupational therapist, then please do add them in the chat. We'd really love to hear what you've been doing to start your journey to become an occupational therapist, and we can hopefully help you think about you know, how that's going to help you as you prepare your personal statement. So these couple of questions, well, I'd like to welcome Cyrus. Hi Cyrus, really nice to have you with us. So Cyrus has just started the second year of our occupational therapy program, haven't you, Cyrus? And I suppose as you reflect on your time and your journey to becoming an occupational therapist, what do you think you needed to, what did you need to know as you started that journey to become an occupational therapist?
So I think the first thing I need to know is about the role of OT in the healthcare settings, because knowing the role of OT means that you know that what skills that you have to develop throughout your course, and what you need to do, and what other healthcare professionals is responsible for, and that definitely has builds my awareness of the skills that I have to develop. Yep. So the first thing that I need to know is the role of OT in the healthcare settings, and what makes the role of OT unique in the settings, if you get what I mean. Yeah.
Yeah, fantastic. And what helped you most in finding out about that and understanding about that OT role, Cyrus, when you were preparing to write your personal statement and your application?
So first of all, I remembered that I listened to a short interview of a student who just graduated as an OT, and she just kind of talked through what she has learned throughout her degree, and about some brief summary of roles of OT, and also the unique skills that we have to develop as an OT. Apart from listening to a short video, of course, I also do a lot of research about the role of OT in different healthcare settings. So that definitely helps me as well. And I'm really lucky to have one of my friends who works in a hospital. So he's the manager of the hospital. So he kind of invited me to the hospital and brings me to different departments, so I could talk to the professionals who are OTs and understand more what they work. Yeah.
Really nice. And I'm imagining that experience of being able to talk to the occupational therapists who were working in the hospitals was really valuable for you, and part of that work experience that you all collected together as part of your understanding all about the occupational therapy role to help you develop your application.
Yes, I still remember when I first talked to the professionals. So obviously he didn't tell me everything about OT, but he take one of the examples, which is the splints, so the wrist splints and the braces, and taught me through the purpose of it and how these adapted equipment is related to the role of OT, which definitely has caught my attention for being an OT in the future.
Lovely, lovely. Thank you, Cyrus. And is there anything else particularly that you did when you were preparing to apply for your occupational therapy course?
So I think it's developing that, or as Sarah has mentioned, is about gaining the your opportunity, building your proficiencies in different aspects. For example, because I know that I would be an OT, so definitely I need more experience or opportunities to maybe work in a healthcare settings, or maybe in some engaging in some volunteer opportunities to build my proficiencies in my communication skills, because like communication skills is also an element that is important in as an OT. So I think apart from really doing research, understanding the role about OT, gaining work opportunities, not gaining work or volunteer opportunities to build your proficiencies is also really important before you apply to the OT course. Yep.
Absolutely, it really is, isn't it? And it's lovely to hear you talking about your occupational therapy work experience, that you got talking and spending time with OTs working in the hospital, but also how you use some of your wider volunteering experiences and really thought about the skills that you were using in those other volunteering experiences and how they might align to occupational therapy and what you can then bring to the profession from those experiences as well. And I think as other people are preparing their personal statements, that's something really valuable to remember, isn't it? That we develop and are involved in all sorts of things in lots of different walks of life, and how do some of those skills, how might they relate to a career in occupational therapy, and how will they help strengthen and support your occupational therapy application as well. So thank you, Cyrus, that's really lovely. So a couple more questions for you, Cyrus. How did you first hear about occupational therapy?
Yeah, as I mentioned, like the summer after I finished my public examination, my friend invited me to his hospital and brought me to visit different departments in the hospital. And that is the first time I come across the profession and occupational therapy. The first thing that really caught my attention about OT is home modifications. Like specifically, it is a kitchen and toilet modification, because in the hospital they've got a stimulated kitchen and toilet where they got all the adapted equipment and to show the patients. I still back then I still remember there's like a perching stool. It is a seat that is tilted at a certain angle and being displayed in the kitchen, and also a raised toilet seat in a stimulated toilet. Back then, although I don't understand the purpose of these adapted equipment, obviously, but what attracts me is that OT also works with patients in settings other than hospitals, which is very different from my impression of healthcare professions. Because I thought like healthcare professions primarily work in inpatient settings such as hospital, but actually OT is doing everything in everywhere, like home, schools, community, hospitals, which makes OT very, very unique. And more importantly, I think it is fun to know that like modifying the environment itself could also help people to engage in everyday activities. Because before I come across OT, I thought the main approach of healthcare is restoring or developing a patient's function. So looking at other aspects of how this profession approach a patient towards rehabilitation, it has really caught my attention. Yeah.
Fantastic, and I think that enthusiasm and passion for our profession is really shining through, Cyrus, and it's really lovely to hear, because I share that passion. So it's really nice to hear it from you too. So anyone who's with us and listening, if you're developing a passion for occupational therapy, you want to share with us how you first found out about our profession, what it is that we do, what some of those first encounters with occupational therapy were that made you think, oh, actually, I might like to become an occupational therapist, do pop them in the chat, because we'd really love to hear about your first experiences of occupational therapy and why you feel you might potentially want to become an occupational therapist. So thank you very much, Cyrus. Really nice to hear from you. And I think we've got Rebecca with us now also, who's another one of our students who's just started second year occupational therapy course with us as well. So nice to have you with us, Rebecca. Looking forward to hearing about some of your experiences too, about what you did in those early stages in your journey to become an occupational therapist. So obviously you've spent a year with us now. In your first year, completed all your studies successfully, been out on your first placement, and then hopefully going to look forward to another exciting year. But I imagine probably now are able to reflect and look back a little bit about what you did before you applied for occupational therapy, what supported your application, and kind of what you know now. So from all of that, Rebecca, what do you think are some of the skills and qualities that OTs really need?
I guess first of all, I'd say you need to be caring, willing to help anyone, you know, all backgrounds, any diagnosis, any age, and also in any setting. As Cyrus was saying, OTs are everywhere, so you need to be willing to work anywhere as well. Being creative, especially when you're helping the patients, what can you do to help them, and think about like the design of different equipment, and good team working skills, especially like throughout the course of you working with different professions in some of the modules, and a lot of group work, and as well when you're on placement and during your jobs, you need to have good communication skills and work with that team really well.
Absolutely. So it's a real range of skills, isn't it, that we need to draw on, not just in terms of those actual clinical skills, but lots of other skills that enable us to do our job, working and enabling the people that we're working with and our colleagues as well, isn't there? So it makes really exciting opportunities and exciting times. And having that ability to be creative, think outside the box, be a bit of a problem solver, are really fantastic skills, aren't they? Because nobody that we work with ever has exactly the same needs, ever has exactly the same wants, and so we find that we're doing different things with different people all of the time, and being able to be creative is a fantastic and exciting opportunity, isn't it? So really nice. And what did you do to help you sort of find out about all of those skills that you thought might be helpful when you were applying for our programme, Rebecca?
So I was lucky enough to be able to do some work experience at Southampton General Hospital. So I was shadowing physios and OTs there, which helped me work out the difference as well, which is definitely important to know. And you know, I just asked the OTs about their journey and what they did, and just observing them, I could just kind of figure out the skills they needed and how they communicated with their patient, and then, like you say, the clinical skills. Yeah, and then I also did some research like the NHS core values before I applied, and have a look at the RCOT website, which is the Royal College of Occupational Therapists, that has some information on the kind of characteristics and personality you should have to be an OT.
So yeah, the Royal College of Occupational Therapy website is a really useful website, isn't it, for us when we're qualified as occupational therapists, when you're an occupational therapy student, and when you're thinking about becoming an occupational therapist. It's a really good resource. They have some really lovely videos on their website, which give you a real little insight into the wide variety of things that occupational therapists might do on a day-to-day basis, the people that we work with, the places that we work in, and all of those kind of things. So some really nice little snippets of information on that website are really helpful as you're thinking about applying too. And I guess another place where that can be really helpful is Twitter. Have either of you two ever been have you used Twitter to try and help understand and deepen that knowledge about occupational therapy?
Yeah, definitely. I've got on my Twitter all the time, following different accounts and kind of seeing what different OTs get up to.
Yeah, so it's a really, really great place to network, isn't it, and find out about what OTs are doing, and maybe make some connections to go and be able to do some of that work experience. And work experience might be virtual, it might be face-to-face, might be a telephone call. There could be lots of ways that you are working and networking with occupational therapists to really deepen your understanding about occupational therapy. So lots of potential ideas there to help you as you're thinking about really deepening and developing your knowledge and understanding of occupational therapy, the skills that you need to be thinking about developing, and how you can develop those, and importantly how you can convey those to us when you are writing your personal statements. So another question for you then, Rebecca. So what did you do to really develop your understanding? You've talked about your experience in work experience. Was there anything else particularly that you did to help develop your understanding?
One other thing I did was, luckily I've got a physio in the family, so they were able to kind of signpost me and got me in contact with another OT so I could speak to them. So I would definitely recommend just speaking to family and friends, seeing if anyone knows any OTs you can speak to. And then I also just did some digging about the uni and managed to find some of the current students who I could then ask questions to as well.
Fantastic, and I'm sure asking other students is a really valuable way of getting a little insight into what it's like to be an occupational therapy student, and as you understand a little bit more about what it's like to be an occupational therapy student, helps you to develop that understanding about what it might be like to be an occupational therapist as well, I guess. Yeah, lovely, thank you. So, so Cyrus or Rebecca, or both of you, I don't know, is there anything else that you think might be really helpful for people to be thinking about as they prepare to apply for our occupational therapy programme? Anything that you kind of know now that you wish you had known at the point that you were making your application?
I think, oh, sorry, Rebecca, after.
No, go ahead, Cyrus, it's fine.
Yeah, I think as Rebecca mentioned, I think one of the most important thing is to know what makes OT unique. And for example, trying to think on yourself, what is the difference between PT and OT would be a great starting point to prepare for either your interview or your career, actually. And like second, you need to make sure you are really passionate in being a profession or working in the healthcare settings. Yep. Yes.
And how about you, Rebecca? Did you have anything that you wanted to add?
I think it's an amazing course, but just be prepared to study hard. You obviously do have time to socialise, but yeah, you do need to knuckle down a little bit.
So hard work, but good fun, sounds like the message. Lots of opportunities, and hopefully you've seen that in your first year, and you will continue to see that as you progress through your second and third years with us. So I don't know if anyone's got any other questions or thoughts they want to pop in the chat, then please do. Cyrus, go on, Cyrus.
Just one thing to add on this having fun in here. I think OT is the best profession in the world, so just be prepared to be the best people in the world. Yeah, that's that thing. Yeah.
So well, we can't get better than that, can we? It's a fantastic recommendation. I agree with you completely, Cyrus. I've been an occupational therapist for nearly 30 years now, and I still think occupational therapy is the best profession in the world, and love every day that I wake up and go to work knowing that I'm able to help people who need help doing the things that they want and need to do in their day-to-day lives, and working at the university, help the next generations of occupational therapists be able to do just that too and have these fantastic careers. So yeah, I'm with you all the way, Cyrus. Fantastic. Okay, so if anybody's got any thoughts or comments they want to add in the chat, share some of your experiences. We're really pleased to hear from you always. So do that. It's always really nice to hear from you. So hopefully listening to the students has really helped you think about where you are in your journey at the moment to becoming an occupational therapist. Start to think about experiences that you've had already, and think about experiences that you still need to get to help strengthen your understanding of occupational therapy, and also strengthen then your personal statement. And when you write your personal statement, we want to see that passion that Cyrus and Rebecca have just shared with us about their journey to becoming an occupational therapist, and their passion about our profession as a whole. We want to see that come alive in your personal statement. So really let us know why it is that you want to be an occupational therapist. And that will really help your personal statement stand out from the crowd. So what is it that where's that passion? Let that passion shine through, and that will really, really strengthen your personal statement. We want to get a sense that you understand what occupational therapy is all about, and you can do that by sharing with us the work experiences that you've done, the OTs that you've talked to, the research that you've done, all that networking that you might have done with telephone calls, on Twitter, looking at the Royal College of Occupational Therapy website, whatever you've done to really deepen and strengthen your understanding of occupational therapy alongside that work experience will really help us know that you know about occupational therapy, and that when you say you want to become an occupational therapist, you understand what that entails. And that's what we really want to hear from you, why you want to be that OT. And do make sure that you share that work experience with us, and don't just describe, as Sarah said before, don't just describe what it is that you've done in your work experience, but take it to that next level and really think about how that's helped you in your journey to becoming an occupational therapist. So what have you learned from it? What things might you take from your work experience and bring with you to the next steps of your journey to becoming an occupational therapist? So what will you bring with you from that direct occupational therapy work experience, or some of those wider volunteering experiences that you might have had, where you've got those very nice relatable skills? How will you bring those with you? And that will be able to really help us understand how you've used that work experience to really good effect. Okay. And then sort of linked with that, I guess, is that thinking about the wider volunteering activities. So you might not have done any volunteering particularly, but you perhaps also have had experiences at school, at college, in your local community. So where else? Think creatively about where you've done different things, where you've got skills that you may be able to relate and align to occupational therapy. So have you had a situation where you've had to be particularly creative about something to solve a problem? Have you been in an environment where you've used some particular communication skills to help support a particular situation? So you might think about those things and how you can use those to pull together to help strengthen your statement too. So hopefully there's lots of ideas about the things that you can add to your personal statements. So when we're making our decisions about who we're able to offer places to, we're looking for occupational therapists of the future who are resilient, who have got some initiative, who are able to demonstrate that reliability, who have got that passion, that enthusiasm, that motivation, who are showing us how they can be creative, how they've got some of those problem-solving skills, how they like to think outside the box. We want practitioners of the future who are able to be insightful, who demonstrate good self-awareness, who are able to reflect on their experiences, know what they've learned, and be aware of what they're bringing to a situation and how they can influence that situation in a good way, or how sometimes that might not be so good, but we want that insight and that understanding of who you are as a person. We want you to show us that you've got good communication skills. We want you to show us that you've got good problem solving skills. So when you're writing your personal statements, how can you demonstrate those things? Have you got examples that you can use to really illustrate some of these skills that we're looking for? And we want to know that you've got an ability and a confidence to work with others and independently. As an occupational therapist, there will be times when you're working on your own, just directly you and your client, and needing to take the initiative and lead and really be responsible for all of that. There are other times where actually it's really, really essential that we work in a very, very cohesive and collaborative way with our colleagues. So we need to be able to do both of those things. And so any skills and experiences that you've got, that you can demonstrate how you've worked on your own initiative, you're able to work independently, other skills where you're able to show us that you are able to work effectively as part of a team, are also really useful to to be able to see that. Okay. So a couple of things just to ask yourself now as you're thinking about what your next steps might be, as you're thinking about preparing that application. So, you know, hopefully some of the things that we've talked about, some of the experiences and reflections from our students have helped you to start to think about what do you need to do next. So do you need to go and be bold and get on Twitter and make some connections to think about understanding and deepening your knowledge about occupational therapy? Do you need to do some networking to try and find some occupational therapy specific work experience? Are you going to have a look at the Royal College of Occupational Therapy website and get a deeper understanding of the role and scope of our profession? So ask yourself, what are you going to do next to really help develop your personal statement and continue on to the next steps of your journey to becoming an occupational therapist? Think about what you know already about occupational therapy, and that's great, but occupational therapy is a very, very diverse profession, and there's going to be an area that you haven't necessarily explored and looked at. So explore outside of your natural comfort zone, where you think you might be interested, where you've got experiences already. Where else can you look to deepen that knowledge, to expand that knowledge, to really see the full role and scope of occupational therapy, so that when you come to us at interview, as well as in your personal statement, you're able to talk in broad terms about that role and scope of occupational therapy, not just the one perspective that you think at the moment you have an interest in or you've had some experience in, but you understand that real broad scope of our profession. So one final little note about your personal statements. It's not, I've got a, oh, there we go, it has caught up with me. It's that my slides were a bit slow to catch up. So as you write your personal statement, just be mindful that as admissions tutors, we read a lot of personal statements, and the ones that very often get through are the ones that shine. So don't just tell us what everybody else might be telling us. How can you make your personal statement unique? How can you make it sing to us, so that when we've read 20 and we suddenly read the 21st, it's yours that sings to us, that we think, yay, this person is really passionate about occupational therapy, and we want to know more, we want to find out, we want to meet them at interview to understand a little bit more about where they're at. So make your personal statement unique, okay? And when you're getting advice about your how to write your personal statement, try and make sure that you think about some of the things that we've talked about today. We want your statement to be that unique thing, rather than just telling us about your academic qualifications and much more of a generic personal statement. We want it to be very unique to occupational therapy, so that we know that you understand about occupational therapy and you've got that passion. Read it through, get someone else to read it. If they feel fired up and enthusiastic about occupational therapy when they've read your personal statement, then you've probably done a really good job, haven't you? If they've got lots of questions, they don't know about occupational therapy, but they're starting to ask about it, then that's probably helped them think, oh, this sounds really interesting. So you're starting to hit the spot in doing something that is actually telling us and sharing that passion and enthusiasm about the profession. All right. Okay. So if you want any further information about any of our programs, they are, you can find information on our website. As Sarah said, at the beginning, there's lots of videos that you'll be able to look at and watch as well. We really would recommend that you do take some time to watch the videos, because they will give you a little bit more in-depth information about our programs here, and there's some really nice opportunities to listen to the videos about the student experience. It's one thing me telling you how great it is to be studying here at Southampton, but actually it's really important, isn't it? Actually, you understand that student experience. What's it like for students studying here at Southampton? So definitely do watch those videos, and that will help give you that insight into what it's like to be an occupational therapy student here with us at the University of Southampton. And we've talked about using all the resources on the Royal College of Occupational Therapy website, and we would strongly recommend that you have a little look at those, dip into some of the resources there. I think there's lots of really nice accessible resources that help understand about our role as an occupational therapist. And if you're interested in reading a little bit more, there's some really lovely supplements in The Guardian about occupational therapy. And so if you just Google The Guardian and occupational therapy, then you should find that you can access those as well, and they give you some really nice insights into different occupational therapists working in different roles across quite a diverse range of areas.